So everyone will get the recording, and I'll also send everybody the slides. So you get the slides, you get the recording, you'll have everything you need for yourselves, and you can share this with your colleagues, your region and state. Okay, so anyway, welcome to this free webinar hosted by Prevention Plus Wellness LLC, located here in beautiful and historic St. Augustine, Florida. You can see today's topic, practical whole health drug prevention. So what we're going to do is we're going to go over an evidence-based planning framework so that you can create your own whole health drug prevention programs or use ours, better understand ours as well. Ours being Prevention Plus Wellness or PPW. So my name is Dr. Chudley Wirch, and I'm the CEO and founder at Prevention Plus Wellness. If you want to know more about what we have to offer in terms of programs and training and other materials, you can go to our website, preventionpluswellness.com. All right, so let's go ahead and I'll show you the slides at any time. I see that people are signing in and saying, hi, this is fantastic. Please feel free to do that as we go through these slides. If you have questions or comments, um, please go to the Q&A, find that link, and I'll take those at the end of today's slide share in the order which they were listed. So, okay, so let's take a look at what we have to offer. This is a little different setup than I've done in the past. Um, I'm using more AI, so I think you'll be able to see some of the difference with some of the content and slides. Using more AI, and so you get this little AI flavor to it. But if you use AI in your businesses and your organizations, make sure you do go over it very carefully because there's oftentimes a lot of errors in it and outdated and misconceptions of things. So, and then you do want to put it into your own format and thinking and logic and language. So that's just my take on AI as we've been using it thus far in our organization. So today's session objectives, there's three of them. So you'll be able to, at the end of today's session, explain what whole health drug prevention is and why it's important for prevention and health specialists and parents and youth and organizations. So, we'll talk about whole health drug prevention. Secondly, we're going to describe, and you'll be able to describe our three-step whole health drug prevention planning framework and including its scientific and theoretical basis. And then lastly, the real, important part, the where the rubber hits the road, as we say, list the next steps for you as a prevention and health provider and your organization with regard to what do you do with this information that we're presenting today? And what do parents do with this information? So that'll be at the end of today's session, and it's the most important. So, how can you use this framework in your own professional or even personal lives to increase youth and young adult wellness and well-being? Okay, so traditional versus whole health. So to give you a side by side, at least one take of this is a traditional approach often focuses, I think, too narrowly on just risk avoidance. Don't use drugs, and once young people have heard that, they're likely to tune that up, particularly as they get older, middle school and high school. Their personal experience doesn't match with that risk information, and so you will lose them in your prevention communication unless unless you address it in a different fashion. And the fashion that we're presenting is this whole health, more a positive kind of approach. So this traditional approach, rarely reflects a young person's complexity with regard to their identities or their environment or their motivation. So the whole health shift is reframing prevention as as a pathway to becoming the best version of oneself. And that's something we all want. We want that for ourselves. We want that for our youth, and our community. So I think the whole idea and focus on whole health and wellness is an absolutely fantastic one for prevention. So, what we're talking about is helping our youth and young adults reach their very best wherever they may be, and wherever whatever their limitations might be, and environments and so forth, still become the very best that they can physically, mentally, socially, spiritually, even. And so this is about integrating, protective factor, a critical protective factor within your prevention programming. So let's talk about the case for wellness. Why is a holistic approach better than a risk-only message approach? So one of the things is that one of the advantages of a whole health is that it focuses on positive identity. And there's significant power in future images. Young people are more motivated by positive future images of themselves than just a fear approach. And that's just scientifically accurate statement. So when young people envision themselves as looking and feeling active, successful, confident, whatever descriptor and image you want to put in there, and there are a number of them, particularly those related to health. These images become the anchor for the decision making rather than a fear of something that might happen to them, or only a fear of something that might happen to them. So you might consider this almost a natural prevention. It's healthy habits versus drug use kind of a prevention. So you're going to highlight these healthy habits: sleep, breakfast and nutrition, physical activity and sports, stress control. These are the big four, I call them, for achieving wellness and avoiding substance use. So, for example, sleep reduces, and this is part of the communication you provide in this whole health kind of a strategy, whether you use our prevention plus wellness programs or you create your own communications and strategies. You want to highlight that sleep reduces the need for stimulants and lowers stress, which drives substance use. Nutrition and breakfast provides natural energy and improves mood stability. Physical activity, movement, sports, and work, all these things releases endorphins that naturally inhibit substance cravings. And stress control, well, removing stress removes the primary emotional trigger for a lot of drug initiation. So this is natural prevention. Healthy habits naturally prevent substance use. Um, so the prevention plus wellness, we had one provider in Georgia who does just an amazing job. Implemented Sport Middle School to over 1,800 kids just last year, just two people, which is pretty remarkable. So, and that data showed that 93% of the youth said that they felt that single session sport program improved their health. And I think that's, looking at a measurable success is really important. So we're all about data driven decisions, and that's why we provide in all of our programs online pre-tests, immediate post-tests, so you can have a track of what's happened before and immediately after that one session PPW program or brief multi-session program in terms of risk and protective factor changes, and then end of semester a behavioral survey to assess actual outcomes on substance use and healthy behaviors. So, and this is what we found in this data set. And so we saw that, youth, and by the way, youth both increase their perception of harmfulness of multiple substances, regardless of what the topic was of the PPW program, and at the same time increase intentions to engage in health behaviors by anywhere from 5 to 17% from just that single lesson. So just to summarize this first part of this session, youth are more motivated by positive future images than fear-based approaches. That's a fact, a scientific fact. Health promoting behaviors, and particularly sleep, breakfast and nutrition, physical activity, and managing stress naturally inhibit substance use and at the same time promote mental and physical well-being. Prevention is more salient to young people, particularly as they get older, older adolescents and young adults, and are more effective when they conceptualize and include wellness as a protective factor. So not just risks, reducing risks, but promoting protective factors. This improves multiple health behaviors because you're addressing multiple health behaviors in a single cost-effective strategy. It's easy to implement. We'll talk more about that in a minute. And it produces diverse measurable outcomes. In other words, not just reductions in substance use, but also increases in these healthy habits. So what's the underlying conceptual model or theory to what we're presenting, this whole health strategy for prevention? It's a behavior image model, a BIM. It's a behavioral science map for whole health prevention. That's what we've used in all of our creation of all of our PPW programs. It's been a circular process of creating integrated multi-health programs, developing a model, the BIM model, behavior image model, testing it out in additional programs, revising the model, and it's been that circular process by which the model and programs have benefited over the years, and it continues. This processing of the process of learning about theory and outcomes, and we're learning thanks to you, with the data we collect and what we learned from you in implementing prevention plus wellness programs across the country and even beyond. So let's take a look at the behavior image model, mapping the behavior image model principles, the core logic, the core assumption of, excuse me, BIM is that wellness-based future self-images, future self-images along with peer image models and multiple risk and healthy behaviors together can be integrated into a single, even brief, whole health prevention strategy. Excuse me. So that's the assumption. It's a rather big assumption. So let's break it all down into some smaller pieces. One of the pieces is a positive image activation, which is this process where you quote unquote cue youth to imagine themselves as active, confident, successful. These future images subconsciously use, and we'll talk more about how to do that, but the subconscious priming unleashes motivational force for healthy behavior choices. So it's not about just information; it's about a cueing or reminding young people or adults, for that matter, of these desired images of themselves associated with these healthy behaviors and avoiding unhealthy behaviors. So another component to this is behavior bundling effect. So if you start on the left with synergy, the notion here is that if you improve one health habit, that can often improve others. So there's this ripple effect across healthy lifestyles. In other words, if one starts getting a little more physical activity, that can also have an impact on nutrition, on sleep, on stress control. So these are all integrated, interconnected behaviors. This is behavior bundling, and this is what we do in our communication of whole health and PPW programming. At the same time, our communications in this model is to connect how substance use is framed as a direct obstacle and conflicts with the desired fit and active and successful and confident image. So you highlight how specific substances, marijuana, e-cigarettes, alcohol, opioids, etc., conflict with desired health behaviors and future images. And then briefly, this efficient, targeted process uses words, uses terms like fit, active, healthy, successful, image terms, and actual illustrations or pictures of young people, models of young people engaged in these healthy behaviors. Images are much more impactful and communicate more efficiently and at both a cognitive or an unconscious and conscious level than just educational in a curriculum, more extensive long form educational curriculum. So images are a great way to communicate effectively. Going back to what I said earlier in our recent case study in Georgia of the 1,800 kids, we saw that healthy habit intentions increased during that one session program, significantly highlighting that young people through that one session sport prevention plus wellness program increased their intentions to engage in these healthy habits: physical activity, nutrition, sleep, stress control. So pausing again, just sort of to give a quick overview. What did we just talk about with regard to the behavior image model, the underlying conceptual theory for whole health prevention? One component was positive image activation. This is where youth are cued or guided to imagine themselves as successful, active, confident, and healthy. Number two, behavior image, multiple behavior impact through this model. This is an integrated model, an integrated health behavior model, if you will. Healthy behaviors, particularly the big four: exercise and movement, sleep, nutrition, stress, those are connected to these positive images as resulting as outcomes from these behaviors, these images, and other benefits. And substance use is counterproductive or conflicts with achieving those desired images and behaviors. So that's why it's a multiple behavior strategy. And we already mentioned behavior bundling. This is the idea that if you improve one health enhancing behavior, that often improves others. So it provides this ripple effect. But it is also important to address multiple health behaviors. And then lastly, brief targeted messages is what's possible in this strategy. They don't have to be brief, but brief means more a greater public health reach, more practical in busy school and other community settings. So efficient interventions can spark meaningful change when they activate identity and future oriented thinking. So that's what young people lack. They lack stopping, pausing, and thinking about themselves in the future. And the process that we're providing, and we'll talk about this three-step process for creating these whole health prevention programs, is screening, feedback, and goal setting. So let's look at prevention plus wellness programs: Sport for Youth, In Shape for Young Adults. These are the two core programs that we created that are whole health prevention. Sport on the left. By the way, SPORT stands for Substance Prevention Optimizing Resiliency Training. So that's why we go with sport. Sport as an acronym. So it links physical activity, this identity of a physically active person, and other health behaviors, and how substance use and substance use avoidance, all within a single brief 45-minute lesson, although we do have multi-session programs as well. This is effective for middle and high school students. We also have elementary school programs. And then In Shape is the evidence-based program for young adults, either in college or communities or military settings. This focuses on fitness and social quality of life and performance enhancing behaviors. Same model, brief behavior image model, same strategy, screening, feedback, goal setting. And then from these two evidence-based programs, all of our other adaptations have come about: marijuana, PPW, opioid, PPW, vaping, PPW, parent training programs, media campaigns, whatever we've created has comes from and highlights this whole health prevention model and strategy. So how is it unique? I think it's pretty clear. We already talked about it. Brevity is certainly important, whether it's a single 45, 50-minute lesson or a few sessions, these brief formats that we create. We did this for a reason, because they're practical in busy school and other settings, and so they're more likely to be used than extensive or lengthy educational or complicated um, counseling kinds of strategies. For example, scripted content. Our program is scripted in our program manuals for implementation to youth in a group or individually or virtually. And this ensures this scripting, this manualizing of the content ensures fidelity and consistency and ease of delivery and reduces training time so fidelity can be provided across implementers, across settings, across population. So there's some real advantages to scripts. Personalized feedback is a part of our programs. It helps youth um, uh, realign their current health behaviors with their personal values and desired future images. I think that's really, really important. And it's tailored, it's personalized to them. When they set set their goals for themselves, that's their personal goal that they're setting based on their values and their desired images that they want to strengthen or achieve. Scalable impact is designed for wide reach, and so our training is only an hour or two, and it's our most popular training is online self-paced. You can take it day or night, weekends, whenever. So anybody can be trained, and that training comes with a certification of 3 years for you as an implementer. So to summarize very quickly, the PPW program difference: single session or brief multi-session intervention formats that are quick, that are easy to implement. Dual focus content promotes wellness while preventing substance use. We've covered that already. Scripted evidence-based lessons ensures fidelity, which is oftentimes difficult to achieve when you have a 15-session program, for example. One session or 3 sessions, it's much more possible and practical. So you're much more likely with this evidence-based program to implement it with fidelity than you are lengthy programs, as you all know. Personalized feedback, really important to give the youth, to help youth stop, pause, think about their current health habits and where they want to go in the future with regard to improving how they perform and feel. And so we've got these short image-based presentations with goal setting that initiates the behavioral change process. It's all built in to this whole health prevention model. And you can see that in all of our Prevention Plus Wellness programs. So let's talk about the 3-step framework that underlies all of our programs and that you can use if you want to create your own content or programs, a practical model for motivating and initiating behavior change. So step 1 of the model: screening and asking questions. So this first step, is you use screening questions, use screening surveys, brief surveys. You use questions to have young people initiate reflection and increase awareness. It forces the individual to stop and think about their current health habits and areas, and as well as strategies for improving their wellness. step one. So, um, questions that are built into our programs or that you can build into your programs. For example, with regard to activity, what types of sports or physical activity would you like to try or do more of? How about a nutrition question to get them to stop and think? What healthy foods would you like to try or eat more of? And how about alternatives? A question like, what are healthy alternatives you can use instead of using drugs, alcohol or drugs? So those are just some kind of questions or survey items that can spark that initial increase in awareness, which leads to behavior change. So, just to summarize, the first step in this whole health prevention model involves, first of all, using screening surveys or asking questions of young people to stimulate reflection of their health habits. And then, secondly, asking them to stop and to think about how they can improve individual health behaviors, particularly the big four: physical activity, nutrition, sleep, and stress control. So that's step one, screening. Step number two, feedback, the feedback loop. So we're talking about communicating wellness, providing positive feedback, nothing negative, because that'll tune out young people, either positive or neutral feedback about the benefits of healthy behaviors that they're engaged in or want to engage in, and then the risks of substance use on those behaviors. This increases positive expectancies, and that will increase motivation for change. So, and it'll increase that internal drive to practice wellness habits. So that's the feedback loop. A little bit more about that. Because this is sort of the core of the communication, the visual identity cueing, as we mentioned before, this is an unconscious anchor. And by cueing desired future images, we help young people link their preferred identity to healthy habits. A young person who sees themselves as active or athletic, for example, is less likely to use substances because they can damage their lungs capacity, their reaction time, their brain functioning, all those things that are important to their image of themselves as being active or athletic, for example. And you can do that with all the health behaviors: nutrition, sleep, stress control. Some tip for effective messaging for you as a prevention and health provider, as well as for parents: frequent praise, provide positive images. As soon as you see healthy habits among young people, avoid blame at all costs. Don't blame young people for not engaging because this decreases motivation. So be careful of that. Avoid blame. Model health habits yourself. Make sure, first of all, you're not modeling unhealthy habits. So if you're using cannabis, don't do it in front of your youth. And and if you are practicing health habits like healthy nutrition, going to bed at a certain time, getting physical activity, practicing meditation, any of these things, do it openly so your youth can see it. You're modeling to them. And consistent disapproval. Make sure you clearly communicate disapproval of young people using all brain altering substances. These are, I think, particularly effective messaging tips for parents. And this is all part of the feedback loop we're talking about. Don't forget, the feedback loop includes, as a part of the second step, also illustrating how substance use harms wellness. You're going to demonstrate how alcohol, how drugs, how e-cigarettes, how opioids counteracts the benefits and sabotages you being active, fit, and healthy, both in terms of actual images and feeling desired feelings. So that's part of it. To go back to what we had mentioned earlier and the outcomes we've seen, amazingly, for, let's say, a sport prevention plus wellness program that addresses primarily alcohol, we also see after that lesson that not only do young people increase the perceptions of harmfulness of alcohol, but other substances. e-cigarettes, marijuana, opioids. So young people are connecting the dots with this particular whole health model. If you present to them that alcohol interferes with their health habits and desired future images, they're going to likely also increase their perceptions of harmfulness of other substances. This is one of the benefits of a whole health prevention program. So to summarize the second step, this feedback step. This is the step that includes communicating to young people the benefits of engaging in each healthy habits, each of the core big four health habits, and which increases positive expectancies or outcomes, which drive motivation for those behaviors. And that's incredibly important. And then, secondly, using positive future images as well as images of peers engaged in these healthy behaviors, illustrations, pictures, videos, whatever you want, uh, so that this can cue their personal identities of themselves, desired identities, desired outcomes of those big four health habits. And then lastly, linking how substance use interferes with achieving those health behaviors, those health habits, as well as their desired images of themselves. So that's the feedback loop. So screening feedback, the third step in his three-step model is the goal planning, the goal setting. This is initiating the behavior change. You're going to have young people set multiple goals, agreeing to avoid substance use and increasing one or more healthy habits. Again, the big four we recommend: physical activity, nutrition, sleep, stress control, essential for self-regulation and positive development. So success is rooted in self-efficacy. That's the belief that they can control their own health. And this is gained, self-efficacy and self-regulation skills, through practicing goal setting. And you initiate that process by having them in this model or in our prevention plus wellness programs to start out by setting first and foremost goals for 1 week, short-term goals, 1 week. And the goal setting contract as we envision it, you can see the elements to the left that are critical. And the goal setting the goal has to be specific. In other words, measurable, has to be achievable. In other words, realistic. Co-signatures are included from valued people, either teachers or um, an adult confidant or a strong friend. Um, to increase motivational force, making it a contract, a public contract, and then a calendar log, which is included in our program materials, to have the youth track their behaviors for the next 7 days. And then that's the beginning process. That's the starting of the process. Here it is laid out in a map, starting from left. You have them complete their initial goal plan for 7 days, and about day 2 or 3 or 4, particularly if you're a parent, but you can even do this if you're a teacher or a coach. You can just raise the issue. Are you still tracking your goals? How's it going? Just reminding them. And at the end of the 7 days, what was successful, what wasn't successful. And now let's take that, what you've learned from that, and set goals for week 2, and then motivate them, support them, reinforce them, incentivize them to continue that process for several weeks. It could be, 4 weeks. It could be 8 weeks. Whatever the case might be, that's what you want. The more goal setting, the more that you're going to develop self-regulation skills and self-efficacy. This strategy, this whole health prevention strategy, can be broadly adopted, has been, and you can broadly apply it in your particular setting. So to give you some examples, so we've seen these very brief whole health prevention programs implemented in healthcare settings and sports settings and U.S. military settings. And the focus here usually is on, promoting readiness, resiliency, performance, and well-being. Family support in the middle, with families providing it through our family training programs, peer training, parent training programs. This is where you want that focuses on parent modeling of healthy habits, praising of healthy choices, and supporting goal setting at home. And then for most of you in the right, schools and colleges and community settings where the focus is on wellness, wellness oriented prevention for young people, for young adults, and their lifestyle to be more successful and to improve mental health. So anywhere these programs can be created, implemented anywhere. So just to conclude, to sort of wrap it up, empowerment versus fear is what we're talking about. Whole health prevention versus risk prevention. You know, by connecting positive self images, health enhancing behaviors, brief motivational strategies, this is the framework that can empower young people to choose healthier paths, reduce substance use. So, not just through fear, but also through aspiration and identity and personal growth. And that's what the whole health prevention model is about and what prevention plus wellness is about. So here it is. Here's the most important thing now. Next steps for you. In the left-hand column, you as professionals, train your staff in this framework and implement any existing PPW programs to build a culture of healthy identity within your organization, whether that's a school or community or state. For parents, the goal should be at this point, the next step, to praise wellness habits, to model healthy choices, and to communicate clear disapproval of substance use. So that's the next steps for you, whether you're a parent or professional or both. These are things that you can work on, and we've given you some ideas for that. If you plan to practice whole health drug prevention, here's a plan, a practice plan. We're preventionpluswellness.com. Here's our phone number, 904, nope, 904 472 5022. By the way, email me at any time at info@Prevention Plus Wellness. And then there's a link there if you want to us to set up a brief Zoom call to learn more about what we offer at Prevention Plus Wellness. But you've got this tool now. You've got this whole health framework, 3 steps, screening, feedback, and goal setting to create your own communications and programs if you wish, or use ours if you wish as well. So you don't have to start, you don't have to create the wheel, if you will. So there you go. I whipped through it very quickly. I think it was a very efficient presentation. So I'm going to pause at this point, and then I'm going to see if anybody had, and by the way, now's the time. If you have any comments that you want to share with your colleagues or the broader group of colleagues and friends attending this, go to the Q&A and drop in that question or that comment, share your knowledge, share your question with them, and we'll take a couple minutes and see if anybody has anything that they want to say or any questions that they want to ask. I'm happy to answer anything. Remember, this has been recorded, so I'll send everybody today a link. I'll put this on our website, and then I'll send you a link so that you can access the recording of this session, and then also these slides in case you want to review them or share them with your others in your organization or region. Okay, so here, see, we do have a couple. So we've got Terry says, hello, is there a cost related to the program's framework? Well, so great question, Terry. There's no cost to the framework. Here it is. You've got it. Go with it, take it, run with it. There are costs for our programs that we've created and tested out, our evidence-based programs and so on. So we have programs on our website, Terry. Go to preventionpluswellness.com. You can do it even now as we're talking, and you can pull it up. We've got youth programs. You can click on that title, and there's a drop down. We have all kinds of youth programs. We've got young adult and adult programs. We've got parent training programs. We've got media campaigns. We've got some other things as well. So we got a lot, actually. And then One helpful hint is if you go to, I think, About Us, there's a link on our homepage, About Us. I think the first part of that, the first item on a drop down is a list of all of our programs and some suggestions. So you might want to take a look at that. It's a list of all of our programs and prices, and that's under About Us on our website, preventionpluswellness.com. But the first step might be, Terry, just to take this the slides and the recording and share this with others to let them see the framework, see what we're talking about, this whole health prevention framework. So, and you'll have the slides and you'll have the recording. So thank you for that, Terry. And then is it Tanya? It looks like Toya. So I apologize if I'm not pronouncing it right, but to what degree are harm reduction methods utilized within the framework? Well, it is without a doubt, because as we said, and this is a great question as well, because as we said, we see from the data we collect, and these surveys are for your use, and we highly encourage all of our providers to use them, and we can give you customized pre-test, post-test, and follow-up post-test links so you can track your own behavior, your own students' outcomes. So, but what we see is that, as I had mentioned earlier, that it's typical for us to see, regardless of what program, let's say sport, which is usually alcohol, uh, emphasis how alcohol interferes with health behaviors and desired images. And what we'll see is we'll see that during that lesson, young people will there'll be increased perceptions of harmfulness of alcohol, but also other substances. Not uncommonly, cigarette use, e-cigarette use, marijuana use, and opioid use. Those are the five substances we measure. So obviously our strategy, this integrated strategy, is increasing perceptions of harmfulness, perceptions of risk, which is a core element. Because if you look at the Monitoring the Future study, for example, which has been going on from the University of Michigan for years, you'll see that perceived harmfulness, perceived risk, as that goes up, substance use goes down, and vice versa. So that's been correlated for decades, for I think 50 years, in fact. So that's important, but it's not enough. So that's why the focus on the protective factors, the protective behaviors, which are oftentimes missing in prevention, whole health prevention. So that's the difference. By the way, our programs, prevention plus wellness programs, while we do use that three-step process: screening, feedback, goal setting, we do connect how the health behaviors lead to benefits, including desired future images and substance use interferes. We also have content in our programs that address other known risk factors, including um, social norms, brief mention of that most people don't use the substance that's addressed in the program. Um, uh, let's see, myths about substance use, healthy alternatives to substance use. So other things are addressed within our brief interventions, other than this connecting of the multiple health behaviors. So great question. I appreciate that. And then Terry again asks, thank you. Says thank you. My pleasure, Terry. So any other questions? Now's the time to ask them, or any other comments. Great questions thus far, and be happy to answer any others or listen to any other comments. Thank you all for what you do. God bless you for what you do, working with youth, families, communities. If we can help in any way, let us know. We're always available. And particularly if you're interested in something that's practical, something that's positive, something that's future oriented, something that's whole health, check out this strategy, this whole health framework. See if you could integrate it within what you're doing, whether that includes using our one of our programs or not. That's up to you. But you can certainly order one of our program manuals, let's say a sport high school manual, that's $600, a online training for $250, and then you're off and running. You can implement that to any number of youth for as long as you want, because it's a single session kind of a purchase. We want as many people who want to implement this strategy as possible. We try to make it practical for them. So the more you implement it, the less it becomes on a cost on a per implementer basis, and you can implement it again to groups or to individuals or virtually. Lots of flexibility. All right, thank you so much. Have a great summer break, all of you. If you need anything, or if you have any questions, info@preventionpluswellness.com, or call me at our office, 904-472-5022. We'd love to work with you. We'd love to partner with you. We'd love to have you get to take one of our online self-paced program implementer training courses. It comes with a 3-year certification for implementation. You can do it in an hour or two. Very practical. Check that out under training, and love to have you do that. Thank you, everybody. Appreciate it. Have a great day and a great rest of the week and a great summer. Bye bye.